So as previously advertised, our luncheon speaker is no stranger to this platform, having just enlightened us as to his likes, dislikes, and uncertainties about healthcare reform. He's now going to speak on a more evidence-based, give a more evidence-based talk based on comparative effectiveness, research, insurers, and insurance markets. And the subtitle of all of this is "Are Insurers Ready for this brave new world that we're about to enter?" I was somewhat remiss before. This is Mark's book, and as I told you, it is thin, and it is in English, and it is available outside at the conclusion of today's program. Right. Ever since Speaker McCormick got into trouble with books, we had to limit the number here. So without further ado, I'd like to recall Mark Pauly to help us digest our lunch. Thank you. And hopefully not make us regret eating what we did.
Thanks, Bob. Yeah, I don't want to cause indigestion, that's for sure. So I'm going to view this as pretty much of a continuation, actually, of the discussion we were already having, which I at least had a lot of fun with and found pretty fascinating. As Bob mentioned, I was asked for lunch to offer some thoughts on a somewhat more narrow topic of the relationship between comparative effectiveness research, insurers, how will insurers behave, and then I think there's a somewhat separate question that I'm going to try to address as well of how will it affect equilibrium or overall market impacts in insurance markets. So that's what I want to talk about. I did want to say, just to clear things up, that the main cheerleader that I was concerned about is David Cutler. I don't view Alan as a cheerleader for the cost containment features of the reform bill, although he did make them sound pretty good. I mean, I think, so I don't think that is a bad thing. Let's give it a shot. I want to stick my neck out and make a few remarks about the relationship between comparative effectiveness analysis and what I call here insurers who sell for money. My experiential background is, it seems like I've been doing comparative effectiveness research. I just didn't know they called it that. But since the beginning, at least trying to understand both the benefits of healthcare of different sorts and the costs of healthcare of different sorts. Secondly, I have done a fair amount of research on the behavior of insurance markets and the behavior of insurers and the behavior of insured people and the behavior of providers who receive insurance payments. And then thirdly, for about 4 years, I was on the board of a nonprofit HMO in the Buffalo, New York area, Independent Health. It's a matter of public record, so I won't disguise their name, which actually gave me quite an interesting perspective on how insurers function. It was another one of those cases of sure it works in practice, but can it work in theory, with many of the things that were said. But the part of that experience that I'm going to be having in my mind today is sitting through a lot of a presentation at every board meeting by the chief medical officer of what we're trying to do to control healthcare costs, particularly in our relationship with physicians. And I need to say, I actually became very fond of Buffalo and my trips there, and also less fond of U.S. Air, but the one was necessary for the other. But Buffalo is a city that's not dominated dominated by a Geisinger or a Mayo Clinic. It doesn't have an integrated delivery system. There is the Buffalo Medical Center there, but it's also not dominated by academic medical centers. It's mostly more like the bulk of America, doctors in private practice and some moderate-sized hospitals. To the frustration of the insurer, those hospitals consolidated into two chains, so there wasn't a great deal of competition amongst hospitals, but nevertheless, and that'll be somewhat relevant in terms of my both anticipation and worries about how insurers will make use of this kind of information. So what I have to say probably really shouldn't, I can't extend much beyond Buffalo, but first Buffalo, then the world. Okay, so the three questions that I wanted to talk about were the one I've already been raising a bit. Will information of this type, I mean comparative effectiveness research type information, which I'll define to be information about the relative outcomes of alternative treatments for a given condition, and it's free, the government's paying for it, and then you can sort of see the skepticism start to creep in here, and it will be made available to people. It falls from the sky. Will it matter, or put a little more positive spin on it, when will it matter? Then what I regard as what was actually an issue to some extent, I think, in our discussions in Buffalo, and is still going to be an issue. And I think Americans are torn here. On the one hand, of course, we'd like health care to be cheaper and health insurance to be cheaper. On the other hand, I guess surveys generally show people are pretty happy with their doctors, with their hospitals, and until people started stirring things up, they were actually not that unhappy with their insurers either. But there is more or less a promise, I think, on offer that insurers will not come between you and your doctor. And I guess to kind of get to the end, I don't see how we can make good use of comparative effectiveness research without at least dealing with that promise and probably reneging on it at least to some extent, or at least redefining it. So that's anticipation of what I want to talk about. And then finally, unanticipated market effects on prices of insurance and products. I have some comments I want to make, some worries, again, because I'm a worry ward, about what will comparative effectiveness research do to the prices of insurance and products. So that's what I want to talk about. I need to say a little bit about the sense I got of insurer behavior. Maybe I already had it, but I think it was kind of reinforced. For one thing, they were nice people there in Buffalo. They kissed their children and put them to bed. When they put them to bed at night, they weren't the caricature. But the more fundamental statement about insurers is they'll do anything for money, and vice versa. So the kinds of things, for example, the kinds of things that insurers are criticized for, not providing unlimited benefits, in a given year, putting a lid on benefits, not writing coverage for people with pre-existing conditions. From their point of view, if they would be perfectly willing to do those things, but they'd have to charge you for them. And I think they anticipate, rightly or wrongly, that if they put those in their products and raise the price sufficient to cover the cost of them, there would be less demand for their product than it is under the current environment. So at least I'm not willing to cast insurers in the role of some kind of evildoers here who are conspiring to do things. If we pay them, they will do it, is the premise of that I'm going to adopt for their behavior. We can talk about that when we get there, I guess, but we'll see.